What are some of the benefits that you've noticed since you started using the third eye?
I mean, the biggest benefit, I think, is that you're just seeing more. And as you're seeing more, you're detecting more lesions, and you'll be able to see behind lesions. And when you're able to see more, detect more lesions, you're more confident about your exam itself also. And then you can say, you know, I mean, we used to think that the colonoscopy was the gold standard, and now that you have, you know, now we know that's not true. It's close, but not the standard. And now we know that if you have third eye added to the colonoscopy, you're almost feeling more like a colonoscopy with third eye is now going to become the gold standard. And you can say, hey, I've done a complete exam, and you know, we're human and we're always going to be missing something, but I think the closest that we have right now at this time with technology is the colonoscopy with third eye to be almost 100% in capturing all the lesions. And I think that's the most important thing that the third eye provides.
Yeah, well, and also we are one of just a few hospitals in our area that offer this, and we have people calling from all over asking for the technology, and that brings more people to our practice, and ultimately finds more polyps, cures more disease, and we feel good about that. The other thing is, when I see a patient in follow-up for a continued abdominal complaint or something like that, and I look back and I see that I did a colonoscopy and it was with a third eye, I feel much better about it. I say, well, you had the best colonoscopy that you could get. And so that's helpful in managing them, because I'm reluctant to put them through another evaluation of their colon.
So for me, the third eye enhanced colonoscopy, the third eye is just one part that enhances what we do, and I feel that there's something that I've called the third eye effect. And the third eye effect has a couple of parts. So we know that the gold standard right now, forward viewing optical colonoscopy, sees about 80 to 85% of the colon. So we're missing anywhere from 15 to 20%. So the third eye allows us to see more. The other thing I think it makes us do is we perform the colonoscopy a little differently. Our approach is a little different, and I think that even enhances our withdrawal time. I don't think adding a couple of minutes here and there is a negative thing. I take that as a positive, because I think we need to spend an appropriate amount of time. Those two things, in conjunction with a good bowel prep and high definition imaging from the colonoscopy itself, leads to increased adenoma detection, because that's the goal. The goal is to find these adenomas to decrease the person's cancer risk, or if you don't find any polyps, at least you could say that you've done everything you could and you've seen as much as you can. And at the end of the day, you know, our job is to give the highest quality to our patients. So I think the third eye effect leads to our ultimate goal as physicians, which is quality.
Dr. DeMarco, we've been hearing a great deal lately about the development of quality standards for colonoscopy. Could you share some of your thoughts in that regard?
Sure. In the future, if not today, but very soon, we're going to be looking more at performance as a physician than the procedure itself. And that is, how are we doing taking care of our patients? Are we doing the right thing? And I think to use the best technology is going to become the standard of care. That is, it makes much more sense to do the best test one time rather than to do an inferior test at more frequent intervals. We're going to be responsible for taking care of many lives, not just doing procedures.